As I'm up now and reflecting on my potential COVID fatigue syndrome and thinking about patients in the emergency room, let me give a lesson to some of the emergency room doctors out there, some of the physicians in general. Let us talk straight to you. You and I both know that at no time in your medical training has anyone ever critiqued you on your ability to do patient education. Almost never. They're not there. They're not around. No one knows how well you explain things to the patients. See, and let me make it clear. You can practice wonderful medicine. And if the patient doesn't understand and the patient doesn't feel better, that is seriously tainted what you've done. For 30 years, I refused to let the other doctors educate my patients because they didn't do it the way I did it. My OCD ass, first of all, you know they had a meeting at Kaiser with doctors where they were talking about patients and electronic medical record, and they actually had to tell doctors that they should introduce themselves to you when they come in the room. I remember saying at the meeting, we shouldn't have to teach you to introduce yourself to patients. That's something your mother should have done. That's what I said in the meeting. See, that's what your mama should have taught you. Okay, you shouldn't have to learn that. Okay, see, these are the kind of, unfortunately. So the average physician in my whole medical career, the average physician did a C- job in patient education. The most of them are mediocre to poor. I'll say it again. Most of the physicians I've ever known, when it comes to patient education, they are mediocre to poor. If you ever want to talk to someone for 15 minutes, not understand a goddamn thing they said, talk to a doctor. Talk to a doctor. See, and that's not the way I did it. First of all, I asked every single patient 3 times if they had questions, and I counted them. Also, part of every visit with me was planning on what to do when you leave here, what to expect during the rest of the night. Many times I would give patients the number to the operator and tell them if they got home and something happened, call me here to this number. The nighttime operators knew me. I told them, I said, you could call here, this number, and they will beat me and patch you through. They know me. They know me at this place, okay? Because that's the way I did it. You get home and the fever spikes again and you scared, call me. Call me, okay? And there are colleagues of mine who used to call me in the call room when their kids were sick, and I said, I'll meet you in the ER. I'll meet you in the ER. Patient education is fundamental to the practice of good medical care. Patient education is fundamental. See, and if you're a physician who's not taking that to heart, you are average at best. Okay? All right? So figure that shit out. Figure that shit out. I know you overworked, so I used to tell them at county. I know you overworked and tired. Patients coming at you sicker than shit, faster than a motherfucker. I got it, okay? But you know what? You're gonna do a good job any goddamn way. You know that? Because that's the way it's gonna be, period. Some of you are on my team at LA County. I don't play that shit. If I go see your patient and they don't know what's going on, you got some shit to hear from me, okay? You may not go home. Because remember, you go home when I say you go home, right? Or you can stay here at the hospital with me. See? Medical training back in the day. That's how it went. Patient education should be first and foremost. Peace.